This is National Women's Health Week, a time to spread the news about things we can do to live better lives. Joining me now with some advice is women's health nurse practitioner Erin Wright from Creekside Women's Center. So nice to have you here, Erin.
Thanks again. It's great to be here.
Your number one tip, stop smoking.
It's a shame I have to say that, but I think it's the most important thing you can do for your health. If you're a smoker, you need to quit.
It amazes me the number of people who still smoke.
Yes, it is shocking. And there are lots of ways that we can help people stop smoking.
Okay, like what?
So the most simple is something over the counter where you can use a nicotine replacement patch to help control those cravings as you try to wean off the cigarettes. Then there are prescription medications that you can see your provider about to help as well.
What's your take on these electronic cigarettes? I've heard some people say that it's a way to help people stop smoking. What do you think?
I am not a fan. I think you're still getting the drug, nicotine, so it's still an addictive substance. Yes, it is eliminating some of the hazards associated with cigarette tobacco, but I still think it's using the drug, which is highly addictive.
Okay, your second tip is to be more active.
That's right. Maintaining a healthy weight is the second most important thing I think women can do. And that's just as simple as getting 20 to 30 minutes of exercise a day, watching what you eat. I think the more we can eat whole, real foods and eliminate the processed foods from our diets, the easier it is to maintain a healthy weight.
And being more active can be as simple as parking in the back of the parking lot,
Exactly.
and walking more.
Taking the stairs, parking further away. Anytime you can squeeze in your exercise, it does not have to be in 30-minute blocks. If you do it 3 times a day for 10 minutes, you're getting the activity you need.
Okay, and finally, get an annual physical.
That's right. Preventative maintenance is key. The guidelines for screening are constantly changing, so having a one-on-one with your healthcare provider to figure out what you need to do in terms of cancer screening, maintaining that healthy weight, and other important things like vaccination and just general health care.
Is this separate from a women's annual physical or pap smear, that type of?
You can do
physical?
both at the same time. You can certainly set up your women's annual and get your pap if you're due for that, and get your mammogram if you're due for that. You can also just come in and have a one-on-one and talk about what you need to do to get healthy.
And this really changes depending on your age, doesn't it?
It does. So the screening guidelines right now for pap testing for cervical cancer prevention are every 3 years until you're age 30, and then you can actually go every 5 years. We still like to see you in the office every year to go over some of the physical exam that you need for screening and to talk about your health maintenance and promotion.
And that's a recent change. When my doctor told me about it, I can see you in 2 years. I thought, what?
Yes.
I don't know about that.
Yes. The reason behind that is that HPV, which is the virus that causes cervical cancer, is extremely slow growing, and most healthy women will clear that virus before it turns into cancer. So we feel comfortable stretching out that screening guideline a little bit longer.
Okay, but the main idea is be seen.
Exactly.
Okay. Erin, thank you so much.
Thank you.